Thank you for the introduction and thank you for the invite. So the transition to parenthood, it's typically a very highly anticipated event. Sorry, I just need to move the gallery here. And it's associated with positive feelings. Typically, people are excited. It's a joyful occasion. It's exciting to have a child and to start this new journey of becoming a parent. But studies also show that it's a time where we may be more vulnerable to mental health difficulties. And during the perinatal period, here I'm referring to pregnancy up until the first year postpartum. And what we find in the general population without diabetes is that depression is something that women may, or birthing persons may be more vulnerable to. And by depression, I mean things like feeling sad, down, things that normally gave you interest don't give you interest anymore. There's could be some self-blame, some guilt, low self-esteem, and we find anywhere between 6.5 to 13% of women will experience this during the perinatal period. And anxiety can be up to 20%. And that's feelings of excessive worry, fear, irritability, kind of feeling on edge, physical symptoms like shortness of breath or your heart racing. So that's in the general population. But what about in the context of living with type 1 diabetes? I have to say here that this was the challenging part of doing this webinar is because there's so little research that's been conducted with pregnant or postpartum or early parenting individuals living with type 1 diabetes that it really makes it difficult for us to say anything concretely. But there's some suggestion in the literature that this is a period where individuals living with type 1 diabetes may be more vulnerable to anxiety and depression as well as diabetes distress. Clearly, identifying the emotional and mental well-being needs of women and birthing persons with diabetes before, during, and after pregnancy has been highlighted as a top research priority. The handful of studies do suggest that the rate of depression and anxiety may be higher in people living with either type 1 or type 2 diabetes compared to those without pregestational diabetes. I mean, if I have to put a number on it based on the few studies there, I would say that it looks like up to 40%, but really we need more studies to have a more precise estimate because there's a lot of heterogeneity in the few studies that are conducted in terms of the timing that depression and or anxiety or these other psychological distress variables were assessed as well. So there's heterogeneity in the timing and heterogeneity, meaning differences in the way these concepts were measured. So we definitely need more studies here. With respect to diabetes distress, and this refers to persistent worry, frustration, anger, or burnout related to managing the condition. Studies here, the few that are existing, also show inconsistencies. There's one study conducted out of Australia, which looked at the rate of diabetes distress in new mothers within the first postpartum year with type 1 or type 2 diabetes. And they found a rate of about 64% reporting elevated diabetes distress, which is quite high. But yet another study, which was conducted last year in Ontario, so here in Canada, with pregnant women with type 1 or type 2 diabetes, they found a rate of distress at about 24%, which is similar to estimates that we find in non-pregnant adults with type 1 or type 2 diabetes. So yes, diabetes distress is an issue here as well during this period, but how severe it is, more studies are needed. What about the early parenting period? And by early parenting period, the World Health Organization defines that as up to 8 years following the birth of a child. Most of the studies conducted to date in the general perinatal or early parenting population have been from right after giving birth up until 1 year postpartum. Very few studies extend beyond that period. So we don't have a good picture of what mental health looks like in the early parenting period. There's a nice Canadian study. It's a longitudinal study conducted across Canada, which followed women from pregnancy up until 8 years postpartum. So that's really one of the longest ones we have in the Canadian context that I'm aware of. And interestingly, they found a rate of about 19% at 4 months postpartum for anxiety and depression, and up to 26% at 8 years. And this is interesting because there's been an assumption that increased vulnerability is only during the pregnancy and postpartum period, but yet we see that these numbers can remain high in the early parenting years. So that shows that there's some persistence of symptoms here. And interestingly, they also found that about 9% of the people they sampled um, scored high on anxiety or depression at least 3 time points. So they assessed 4 months postpartum, 1 year to up to 5 years on a yearly basis, and then at 8 years. So at least three of those time points, people were showing significant symptoms of anxiety or depression, suggesting that these symptoms either persist or they reoccur. People either, they go down and then they start experiencing the symptoms again. And that's important. That has important implications for proper screening and monitoring and for treatment as early as possible to prevent these reoccurrences from happening. But this is in the context of of early parenting in people without diabetes. There may have been some people with diabetes in the sample, but certainly they weren't. They didn't look at subgroups, so we really don't have a clear picture of what the early parenting period looks like in terms of mental health for moms and birthing persons living with type 1 diabetes. I've been talking about moms and birthing individuals, but what about dads and non-birthing partners? They too, emerging studies in the last decade have shown that they may also be at higher risk for mental health difficulties. The prevalence, and we conducted a study as well across Canada, one of the first studies to look at depressive symptoms in fathers, first-time fathers, and we found, and others have also shown, a rate of about 8 to 10% during the perinatal period. And some of this already starts to happen during the partner's pregnancy. So I'm talking that these rates are 8 to 10% either and in the pregnancy or in the postpartum period. And anxiety can occur in up to 11% of fathers. Now, again, this is fathers who the majority do not have diabetes. We really don't have any studies that have specifically focused on the transition to parenthood among men with chronic conditions, including type 1 diabetes. That's certainly on my radar in terms of something that I would like to do in the future because there is really a big gap here. So why is mental health important during this life stage? Mental health is important throughout the whole lifespan. Impaired emotional well-being can interfere with our ability to manage diabetes. When you're feeling psychologically distressed, there's less engagement and motivation to do the things that are important to do daily in order to self-manage type 1 diabetes. And that can lead to poor glycemic control, which in the long term can increase the risk of long-term complications. Untreated depression or anxiety in the postpartum period can increase the risk of reoccurrence of anxiety or depression in the coming years. Certainly, when one is depressed or feeling anxious during this life stage, it has an impact on our quality of life. Can have an impact on our couple relationship. It can have an impact in the way we parent. We're less tolerant. When we're feeling depressed, we may be less present. Our communication style may be different. So it's really important to address mental health during the early parenting years. What are some of the psychosocial challenges experienced by people living with type 1 diabetes in early parenthood? There's been a few qualitative studies that have looked at psychosocial challenges in mothers living with type 1 diabetes, one of them from Sweden, which sought to identify the types of struggles that moms were experiencing. And they reported some difficulties with breastfeeding in terms of initiation, in terms of sufficient breast milk, and this caused stress and anxiety. Women reported uncertainty and unpredictability related to caring for the newborn and at the same time managing their diabetes. There were concerns about losing the professional support, which they felt was very present during the pregnancy period. And now that the baby was born, they kind of felt on their own. Certainly, mental health and diabetes distress was a strong theme in the discussions in this particular study. A couple of other studies have similarly shown that dealing with glycemic control and the data demands of parenting, um, these both of these big demands can certainly contribute to anxiety and feelings of guilt. They talk about navigating the dual role of parenthood while living with diabetes. Early parenthood phase is described as a period of redefining and readjusting to life with this new baby that now requires care 24/7 almost, and at the same time continuing to do everything you're supposed to do in order to manage your type 1 diabetes. And women described that in the absence of good support, they felt quite lonely and quite isolated, like no one really gets what they're going through was something that was expressed in these studies. One qualitative study which sought to examine some of the main concerns of early motherhood for women living with type 1 diabetes. And this quote I felt illustrated really well the feelings of isolation and loneliness that some moms report. I had to go for walks with healthy mums in a mums group, which was actually quite odd. Our situations, our experience were actually so different, and I felt pretty alone. I could really use a support group for diabetes. And that's something that comes up quite a bit in the context of living with type 1 diabetes and going through specific life stages as well. So really that part of the webinar is trying to convey what little we know about living with type 1 diabetes and becoming new parents from the existing literature. So I felt that it was important to include in this webinar some really practical strategies to help with promote emotional well-being, to help reduce stress and better manage feelings of anxiety, for instance, or depressive symptoms. And this is relevant not only to the early parenthood period, but really it's relevant to everyone living with type 1 diabetes and other the general population as well, because we don't pay as much attention to these things as we should in terms of promoting or preserving our mental health. And the ones I have in bold are the ones that I'm going to discuss a little bit more. Regular exercise and healthy diet, of course, are very important to both your physical and mental health, but I'm going to focus more on the psychosocial ones, which might not get as much coverage. I also want to note that it's not a one size fits all. I always tell my clients that it's important to have many tools in your toolbox because some tools will be better in certain situations than others. And there's also individual differences and intra-individual differences. What might work well for you may not work well for me, and what might work well for me may not work well for me a month down the line. So we really need to experiment a little bit, to try various things, to practice and to track how we're feeling. This is one that I usually implement early on when I see clients who are experiencing excessive stress and who want to learn how to better manage stress. And that's learning to say no. We live in a society where it's very easy to get pulled into everything and to feel like we need to say yes to everything. We have a tendency to like to please others. And so this is comes at a cost, which is the feeling of being overwhelmed when we look at our to-do list and see how much we've committed to. So it's important to set limits, but not taking on more than you can handle. Don't feel like you have to say yes all the time. People are more understanding than you might think. Determine what's important to you, what your limits are in terms of your time, in terms of your energy, and in terms of your responsibilities. Seek social support. This one is pretty crucial. By social support, I'm referring to comfort, care, and practical assistance that one might get through different relationships in the people in our network. Here, it's important to rely on your support network, which may come from partner, family, friends, and even healthcare providers, depending on what it is, for assistance. Don't be shy or hesitate to ask for help. What's the worst that can happen? They'll say no. But people are often willing and enjoy being supportive to others. Just think of all the times that you've supported others. People like to reciprocate that. It's important here to also, find someone that you're comfortable in talking about how you feel. Talk about your concerns. Don't bottle everything up because that tends to, you know, increase our feelings of psychological distress and feeling overwhelmed. Sometimes it's really helpful to just get it out and to have someone listen to you and validate how you're feeling. They don't necessarily need to come up with solutions, but just knowing that you are heard can make a difference. And communicate your needs clearly. This is important because a lot of times we assume that people in our network should know what we want. They should know the kinds of supports that we're needing. But in fact, people are very bad at mind reading. We think that people know what we're thinking, but in fact, we're not very good mind readers. So, and your needs can change over time too. So it's important to clearly express what it is you're needing at the moment. Peer support, as we saw in some of those qualitative studies, can be really important. And peer support, these are the people who are similar to you and who can relate to what you're going through. So in this case, other parents living with type 1 diabetes. And I like this article that was written by Carrie Sparling on being a parent with type 1 diabetes. She's an advocate for patients with type 1 diabetes, and her article was quite compelling. And I'm just going to read you a quote here, which illustrates the importance of peer support. Just as parenting groups are terrific for helping new parents to find their way together, the same goes for parenting groups for parents with diabetes. It's a niche of a niche and necessary. What other group understands better when you admit that you had to steal your kid's juice box to treat your low blood sugar? Finding people who get it helps turn down the heat on diabetes-related worry. So peer support is described as giving the individual a sense of belonging. They feel understood. It normalizes the experiences of diabetes care along with parenting responsibilities. Just having others share their experiences, share their challenges, and some of the ways that they've overcome these challenges and some tips or strategies for dealing with some of these difficulties that may arise can really help others in the group in terms of their own problem solving and their own getting their own ideas in terms of how to better manage situations that arise. Another helpful tool for promoting one's mental health is the practice of relaxation techniques. Relaxation is a state of low physiological arousal and is associated with feelings of calmness and a sense of being at peace with oneself. It's the exact opposite of the fight or flight response, which is what we feel when we're feeling stressed. There are many forms of relaxation techniques out there. People always ask me, is there one that's better than the other? But really, it's about finding something that fits with you, that resonates with you in terms of giving you the sensations of relaxation. Progressive muscle relaxation, which involves tensing and relaxing various muscle groups in your body, is one. Meditation is very popular. Guided imagery is another form of relaxation. And what these all do is they elicit the relaxation response. It helps turn off the stress response and elicit a relaxation response. It helps reduce feelings of stress and muscular tension. It improves our emotional well-being. It can be helpful with chronic pain, insomnia, symptoms of depression or anxiety. It really has been shown to be useful for a variety of conditions. But remember, this is one tool in the toolbox. We usually need a number of tools in order to manage these situations. But the common core to successful relaxation skills is usually they require a practice of 15 to 20 minutes. We need a quiet environment. You need to have a passive attitude. And by that, I mean it's normal for intrusive thoughts to pop up in your mind. That happens. Don't be hard on yourself. Just let it go, acknowledge it, let it go, and go back to what you were practicing. And of course, in order to reap the benefits, it does require consistent practice. But I mean, realistically, you may not have time to start with something of 15 minutes. You might want to do something that's of shorter duration and then build up over time. There's some helpful apps out there that can guide you in some of these types of relaxation practices. The Calm app and Headspace are two that are receive very high ratings. I personally like the Calm app. I like that they have different durations of relaxation. So the 3-minute one, I can easily integrate even during my workday when I need a pause. You should, consider if you don't have downloading these apps to kind of give you some guidance. Abdominal breathing or belly breathing is also one that's nice to start with. It's a type of breathing that creates a relaxation response throughout your body quite instantly. And once you've learned how to do it, it's quite portable. You could do it anywhere in your workday, in public transportation, and people won't really notice what you're doing. And this really involves taking in a deep breath, okay, as deep as you can, and feeling your abdomen expand, holding it for a minute, and then letting it go, exhaling and feeling your abdomen contract. You can do this 4 or 5 times during one practice, and you'll see it can be very helpful in terms of taking it down a notch. Sleep. We underestimate the importance of sleep for our physical and mental health. Sleep is typically compromised in the postpartum period and in the early parenting years, that's for sure. But sleep is essential for our health. Between family, work schedules, household difficulties, it can be difficult to prioritize enough sleep, but practicing good sleep hygiene really is critical. It's also important in terms of diabetes self-care because we know when we sleep poorly, that can have an impact on our energy to manage our condition, which can have an impact on our glucose numbers, and it's a vicious cycle. So some good sleep hygiene practices is one, protect your need for sleep. And for that, I mean, if your alarm clock is going to go off at 6 and you're only going to bed at midnight, well, you've only carved in 6 hours for sleep. And ideally, you want to sleep between 7 and 8, ideally. So, try not to go to bed too late. Keep your regular sleep hours, even on the weekends or on days off. Try to go to bed at the same time. Get enough daylight. It's important to regulate your sleep patterns. Get outside, open up the blinds. This is especially important in the winter when it gets dark so early. And be careful with daytime napping. I'm not saying not to nap, but sleep experts argue that short naps are best. So between 20 and 30 minutes at the same time of the day, preferably in the early afternoon. Later at night, it may have an impact. Later on in the afternoon, it may have an impact on your ability to fall asleep. It's important to wind down before bedtime. Create a routine that helps you wind down from the day. And that can look different for different people. Make the bedroom a quiet and comfortable place. Ensure that it is a sleep-only zone, meaning try to limit the bedroom for just sleep and intimacy. No TV, no social media. It's not a place where you should suddenly decide to have a heated discussion with your partner. Try to work in a different place of your home. And really, the idea is you want to associate the bed with sleep. This is what the bedroom is for. And use other places in your home for other activities. Turn off your cell phone and electronic computers. This is something that has become a challenge across all age groups, but really the blue light may decrease melatonin production that comes from these gadgets. And not just that, but you really want to do something that prepares you for sleep. You don't want to be, on these gadgets, stimulated with whatever it is that you're seeing or reading, and that can have an impact on your ability to fall asleep and stay asleep. Okay, change your thinking. And this stems from cognitive behavioral therapy, where really many times the way we are responding to a situation, how we feel in response to a situation, has a lot to do with the way we're interpreting that situation. That middle piece is really important, our interpretation of the situation. We tend to see things when we're feeling down or we're under a lot of stress, we tend to see things more negatively. We tend to focus in on the negatives only of that situation and not look at the whole picture. We tend to set high expectations for ourselves, particularly when trying to manage diabetes and trying to be a good parent. We aim for perfection, and that is really difficult because parenting is one of those things that it's one of those jobs that we have for a very long time. And it's the one that we're least prepared for. Think about what you do and the work you do in your profession. You get a lot of preparation for that typically. But when you become a new parent, really there isn't the book out there that prepares you to be the perfect parent. It's one that, it's an all-encompassing job that requires you to learn a lot on the job. So, don't be so hard on yourself. And for the concept of reframing your thinking, there's some good apps out there. Um, the one that I like is Healthy Minds. It was created by psychologists in the US. It's free to use. So if you want to learn a little bit more on the technique of reframing your thinking, Healthy Minds is a good one, as is CBT Companion. That also gets a good high rating to learn some of these strategies. And sometimes, you need to consider professional counseling to really put these into practice. Um, so no talk on promoting mental health during the early parenting period or any period would not include the concept of taking some time for you. It's very common for parents to put the needs of others above their own. But there's a price to that. When you don't take time to care for yourself emotionally, and your emotional health and your physical health can be impacted. So self-care and taking a little time away to pause is important. It's not being selfish. We need to change our mindset of time for you. It's essential and it can be very replenishing. So it's important to do it without feeling guilty. It's not as effective if we're, trying to enjoy a little time and we're feeling guilty about not being with our family or not doing everything that is on that to-do list. By taking care of yourself, you have more to give to your children. You're much more patient, you're much more present when you're not feeling overwhelmed and feeling like you're at the end of your rope. Self-care can look very different from person to person and even from day to day. It doesn't have to be something big, some grand activity. It really can be anything that helps you to relax. The key is to get into the routine of doing it, even if it's just for 5 minutes. Doing it on a daily basis can really help you take a pause and help you relax a little bit. So, some key takeaway messages: parenting while self-managing diabetes is demanding on a daily basis. You don't get a break from both, they're both all encompassing. And parenting, particularly if you're a parent for the first time, it can be quite unfamiliar. Your mental health matters. Okay, it's important when we're living with a chronic condition. There's a lot of focus on physical health, of course, but mental health is very important too, and they can be quite intertwined. So it's important to prioritize your mental health as well. Seeking support from your family, friends, peer support, healthcare providers, very important because a lot of times mental health is not asked in the course of a consultation with in primary care with your GP or a specialist. We often are the ones as patients that need to bring it up. So, if you're having some concerns about your mental health, about sleep, and they've been persistent, it's important to talk to your healthcare provider about it. And I hope I've emphasized the importance of prioritizing a little time for self-care for your emotional health as well. Okay, so having said that, to address some of the gap in literature that we have with respect to emotional well-being and the needs of women, birthing persons with diabetes during pregnancy, during the pregnancy planning period, and in the early parenting period. We're currently conducting a study, which you may have heard about through the newsletter on the Better newsletter. And basically, this is an online survey which will tap into your emotional needs and diabetes-related self-management strategies or challenges experienced during this time. And the key here is we're going to use this information to adapt a platform that we've already created for the general population during this period, which is about promoting mental health and healthy behaviors during this period. And we want to create a platform that is specifically tailored to the needs of women and birthing persons living with type 1 diabetes during this life stage. Thank you.
So thank you, Dr. Da Costa, for this great presentation. I think it is full of practical tips, which I know parenthood can be very busy. So to stop and take time for ourselves and make sleep our priority, I think it's a good reminders
Mhm.
always. Thank you for this. Um, if anyone has any questions or something they'd like to share, feel free to use the Q&A button of the on the bottom of the Zoom screen. Meanwhile, we have if you're not already on the Type 1 support self-management education platform, um, you can sign up. We've put an example of educational material we put there, and we do have a fact sheet on
Abdominal breathing, I see.
yeah, we have one on
Good.
abdominal breathing and another one with mental health resources across Canada. So we thought we'd share it with the participants of the webinar. I also see you put the link to your study, so that's great. I think it's good resources for everyone in a domain that is not studied enough and where there is a lot to do and support to give. So that's great. So I don't see any questions coming in. I was wondering if you saw in your so if I understand correctly, when the as the child becomes older, the anxiety seems to increase, the number of people with anxiety and seem to
Yes,
increase
I
it.
was surprised to see that. I mean, we
Mhm.
need more of those studies, but it seems to be that it certainly doesn't decrease. If anything, it seems to increase. And at that point, there may be another child that's happened in the course of those 8 years, which, of course, things accumulate.
Mhm.
But we certainly need a better understanding and better supports because all the monitoring seems to be in the first year, but
Yeah.
there seems to be some support needs later on as well.
And this was until 8 years old, if I recall.
Exactly.
But then teenage years must bring their own challenges
Yeah,
as well.
exactly.
Someone with diabetes would have, well, any parent, but
Yeah,
someone having to manage their own blood sugar would definitely have to be flexible in the way they adapt to these lifestyle
yeah, for
changes.
sure. Good.
Someone is talking about a program. I was part of a program. I'm sorry, I'm not able to elaborate on that. If you want to write a bit more, maybe someone just, I'm not sure I understand the question that was posted. Maybe it's about the study you discussed earlier. So if there's no other questions, I think we will thank you again for giving this great talk.
Thank you. Thank you for
Here.
the invitation.
Okay, there is one question. Um, to have my child see is a program to have her child see if she would have type 1. So there are some screening uh, program research protocols right now screening for close ones to see if they're at risk of having
Right.
type 1 diabetes. That's a whole subject in on its own,
Yeah.
which brings a lot of questions. It's really because we know that now there's an approved drug to delay the onset of type
Oh,
1 diabetes in someone at risk. So I think this is what the person is
yeah.
talking about.
Important topic.
There is a webinar on this on the Better website that was given last November if you want to go and see this webinar. Okay, so thank
Great.
you once again.
Thank
I'll
you.
let you off and have a wonderful afternoon, everyone. Thank you
Thank
for
you.
joining. Thank you.
Bye-bye.